Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Debbie Sumantri, infection preventionist at PIH Health Hospital, to talk about how her team is using rule-based AI to prevent hospital onset cases, improve patient outcomes, and drive smarter infection prevention practices. Excited to have you here today, Debbie.
Thank you for having me.
Let's get started with a little bit about your background in infection prevention and the role you play at PIH.
Okay, so unlike my coworkers, my background is research in epidemiology and infectious disease. And I have been working as an infection preventionist for about 3 years now. And I collaborate with nursing staff, clinical staff to really increase patient safety.
So your team began exploring new ways to use data and technology to support infection prevention. Tell me a little bit about that.
Yes. So because of the uptick in cases that we have in 2023, we began exploring rule-based AI generated data to help us collect the information that we need to start improving our C. difficile number.
So we know that C. diff is a major cause of hospital-associated infections, and because of that, early detection is critical. What challenges did your team face in identifying and managing cases quickly enough to prevent hospital onset infections?
That's a great question. So before this project, before having AI helping us generate reports, our staff really struggled with early detection of loose stools. We had challenges where we could not document early enough, we could not identify the necessity for testing early enough, and therefore that led to delay in treatments, delay in isolation, and that could have really caused an outbreak.
So AI sounds like it was a game changer in this overall detection process, but walk us through kind of what that looks like in practice.
Yeah, so this report really collects the number of patients that began having type 6 or 7 loose stools or diarrhea, and that really helps us to see or when to notify our staff, our nursing staff, and that lets our charge nurses, frontline staff know which patients to isolate and which patients to test. So that is a really big change in our practice.
We know that AI has been huge in healthcare, and AI can surface data, but it takes people and a process to really turn that data into action. How did you work with nursing and frontline staff to make the alerts meaningful in daily practice?
There's a lot of education that went into this. We had to build establish communication with staff to make sure that they know what they're doing and to make sure that they know how to utilize the report. And also for us to really work with our frontline staff on how to treat patients the right way and how to notify our physicians when to treat the patients, and therefore preventing outbreaks.
This project has shown measurable results quarter over quarter. What outcomes have you seen since applying this rule-based AI to identify potential C. diff cases earlier?
So the results were really reflected in our numbers. Our benchmark overall is increased. We are seeing a significant decrease in our cases of hospital-acquired C. diff, and that is really a big deal for us.
That's awesome. How do you think that these tools are going to continue to evolve in hospital settings? And is there any advice that you might share with other infection prevention teams who are looking to integrate analytics or AI into their workflows?
Sure. I would say begin collecting your data points, look into measurable outcomes, and really AI is the future of healthcare nowadays. So I say that as long as you have measurable data points and outcomes that you want to see, look into AI-generated data because it could really help you identify what needs to be improved in a facility, healthcare facility to be exact.
Well, Debbie, thank you so much for the insight and congratulations on all the success with this program. It's been a pleasure talking to you today. Thank you so much for being here.
Thank you.
And for those watching today, keep an eye out for our next episode of INOvators.